Hello everyone. So in this session, we will be discussing about the various medicaments or solutions what we use in oral and maxillofacial surgery, like Carnoy solution, Whitehead's varnish, Horsley's bone wax. So like so many terms are there which will come in your MCQs. So you should be knowing it. Number one, what is it? What is it used for? And what is the composition of it? So let's go into one by one. The first and foremost is Carnoy solution, which you all know it. The composition of Carnoy solution comes in the exams as an MCQ bit. So what is the function? It is a fixative solution. It will fix the tissue. Like it is used for odontogenic keratosis when you do an enucleation and remove everything. And then this solution, if you apply, whatever daughter cells are there, it will fix the tissues. So what is the composition of this? Composition is 1 gram of ferric chloride dissolved in 24 ml of absolute alcohol. So that is what. So you can remember with the mnemonic like GAC. That is G for glacial acetic acid, A for absolute alcohol, and C for chloroform. So G for glacial acetic acid, A for absolute alcohol, that is ethanol, and C for chloroform. And the composition, the percentage is also there on your screen. So Carnoy solution is a fixative solution. Next, coming to Whitehead's solution. Whitehead's varnish or Whitehead solution, you can call it. This is pigmentation of iodoform compound. Okay, so this is a solution which is given when there is an inflammatory conditions like dry socket, or when you have done a case of maxillectomy, an open dressing has to be done. You have to clean that area. So that time you can give Whitehead solution. So what is the composition of Whitehead solution? You can remember with the mnemonic BIS.B. So BISS and B. So first B is benzoin, I iodoform, S storax, another S solvent ether, dot B. So other B is balsam of Tulu. So BIS.B with a mnemonic, you can remember this, it will be helpful. So Whitehead solution for inflammatory conditions, socket like dry socket, and your maxillectomy post-operatively, we use this. Next is your Tabort solution. So Tabort solution is used as an astringent in pericornitis. So pericornitis means inflammation of the gums of the operculum or the third molar area. So there is a lot of pain and discomfort. So and if you apply this Tabort solution, it will give soothing effect. So that is the major role of astringent. So what is the mnemonic and what is the composition? You can just remember Wig is made up of zinc. This is just a mnemonic. Wig made up of zinc or water, iodine, glycerin, zinc iodine. This is the composition which you should remember. This comes there. Next is your Mackin's solution. Mackin solution, which you know very well, it is there in your endodontics also for vital bleaching. You do it, used for bleaching of vital teeth. So the discoloration will be gone. So what we use here, 1 part of anesthetic ether, 1 part, that is 0.2 ml, and 5 times more, 5 parts of HCl, which is 1 ml, and 5 parts of H2O2, that is again 5 parts. So it is 1:5:5. 1 part is ether, 5 parts is HCl, hydrochloric acid, and another 5 parts is hydrogen peroxide. So Mackin solution, bleaching of vital teeth, you use this. Next is your bone wax, that is your Horsley's bone wax. So this, whenever there is massive bleeding from the bone, you can take this wax and you can apply on the bone. So bleeding will stop. So it is used to reduce the bone bleeding. So what is the composition of this? Beeswax, which is 7% by weight, then olive oil 2 parts, and phenol 1 part. So step by step you should learn all those things. This is very important. Next, coming to bony solution. So this is not important. gentian violet, brilliant green alcohol water. This is the composition. So this is just one of the things. So I just added up. It's not that important. One is solution. Next is tumescent solution. Very important. This is tumescent solution. What do? You mix local anesthesia, and that is lignocaine and ringer lactate solution. You mix it and make it a solution. This is basically given in facelift surgeries. So when the liposuction surgeries are done, facelift is done. So that those kind of surgeries you use this. So it is 2% lignocaine, 25 ml, 1:1000 epinephrine in 1 liter. It is used, and ringer lactate solution, that is your 1000 ml, is used here. So very important, tumescent solution. Next is keel bone. What is keel bone? It is a bovine bone plus hydrogen peroxide and plus defattening agent. So these three are mixed and they come as a keel bone. Then Monsell solution. This is used for arresting capillary bleeding and post extraction from the medullary bone. You have done an extraction from the medulla, bleeding is happening. So that time you can use Monsell solution. What is this Monsell solution made up of? Ferric sulfate, and the mechanism of action is by precipitating of proteins. Precipitation of proteins is the mechanism of action which is asked as an MCQ. Then some other solution, Gessner solution, not at all important. This is like used for the peeling of any scars are there. So there, salicylic acid, resorcinol, lactic acid, and ethanol. Then next one you have got Baker's solutions. Baker's phenol solution, again not important. Phenol, distilled water, septisol, croton oil are the composition of Baker's phenol solution. So these are the solutions what we use: Whitehead's varnish, Cornish solution, tumescent solution, keel bone. So these things you should be remembering. So let us solve an MCQ. So chemical cauterization in odontogenic keratocyst is done by, so we have got 4 solutions now. So chemical cauterization. So cautery is what? Cautery means when you put it, the electrocautery, there will be 2 loops when you punch it. So cautery can be used for sectioning also. It can be used for ablation also, or it can be used for fusing 2 things also. We will be reading that in a later topic. So this chemical cauterization with the help of chemicals in OKC. So OKC, if some cells are remnant, we have to use a fixative solution which will fix those tissues. So we have just discussed that Carnoy solution is the one which is the fixative solution, which is very good for OKC. So first enucleation will be done, the all cystic lining will be taken up. So once physically, manually, when you are very sure with your eyes, yes, everything is taken out, then you can apply Carnoy solution, and whatever remaining daughter cysts are there, that will be also freezed and fixed over there, and then you can do the further follow-ups for that. So this is all about this topic called medicaments, what we use in oral and maxillofacial surgery. Thank you.